Hello, my name is Kyoung, and today I will be presenting on work that my co-authors Yuhan Luo, Beth Saint-Jean, Kyoung Choe, and I have done, titled Patients Waiting for Cues, Information Asymmetries and Challenges in Sharing Patient-Generated Data in the Clinic. In this paper, we define the term patient-generated data as health-related data created, recorded, or gathered by patients or other caregivers to help address their health concerns. Patient-generated data, PGD, show great promise for informing the delivery of personalized and patient-centered care. However, patients' data tracking does not automatically lead to data sharing with clinicians, which can make it difficult to derive optimal benefit from PGD. While there have been many studies on various aspects of PGD, we still have limited empirical data and knowledge about patients' real-world data sharing practices in the clinic. This research gap led us to the following research questions. First, what types of PGD are actually shared within a primary care setting? Second, what kinds of factors and cues prompt or prevent patients from sharing their data with clinicians? To answer these questions, we designed an on-site study to capture patients' vivid empirical data. We recruited patients who had just met with a clinician at a university health center and conducted 57 short one-on-one on-site interviews. Participants were relatively young patients whose age ranged between 18 and 37. We captured patients' first-hand PGD sharing experience in an ecologically valid approach. For interviews, we set up desks at an area designated by the health center and recruited patients as they exited clinicians' offices. We asked about their current PGD tracking practices, whether and how they had shared their PGD during the particular visit, and the reasons behind their decision to share or not share their PGD with the clinician. The interview data was analyzed through an iterative open coding process. Also, we analyzed the data to identify patterned behaviors. I will be reporting the findings that are the basis of the two main themes that we identified. First, large gap between data tracked versus data shared. Among the 57 participants, 93% said that they had shared their PGD with a clinician during their visit. However, in many cases, there were large differences between the types of PGD that they had tracked and the types of PGD that they shared. All the participants reported that they had kept track of at least one type of PGD, but a majority of the tracked PGD were not shared. Interestingly, participants often shared the PGD that they had not tracked, but were able to recall from their memory. We found a small overlap between the PGD tracked and PGD shared. Interview data indicate that patient-clinician interaction can play a role here. During the meeting with her clinician, participant 29 realized the need for PGD tracking and PGD sharing for her future visits. Second, ways of PGD sharing. A few participants used their devices and tracking records, such as mobile health apps, to share their PGD with clinicians. And a few others considered providing information through the health center portal's online appointment forms to be a PGD sharing. However, most of the patients, 81%, reported verbally sharing PGD with clinicians, relying on their memory, often as they answer clinicians' questions. Participant 51 relied only on her memory, and she indicated that she could have shared a little bit more about what was going on by sharing her exercise data, but it kind of slipped her mind. We also identified a prevailing pattern regarding patients not sharing their PGD with clinicians for the following reasons. First, no PGD sharing if clinicians do not ask. Except for a few proactive patients, it was a dominant pattern that patients did not share PGD unless they were asked to do so by clinicians. Participant 6 thought that he might have shared potentially helpful PGD if his clinician had asked questions about his PGD. Some participants made their own judgments on the relevance of their PGD. They believed their PGD were irrelevant to their health issues and they did not share it. Now I'll be highlighting the two major themes and design implications that we identified through the analysis. Information asymmetries and information gaps. First, information gaps for patients. Our participants believed that their clinician had more knowledge and information about their health and would know what additional information or PGD was needed to examine their health issues. Patients felt unable to determine whether their PGD sharing would be beneficial. This indicates that patients' PGD sharing or non-sharing can be influenced by this information gap. Another aspect of the information asymmetries pertains to patients tracking and storing PGD only in their personal information spaces. Patients have more information about their PGD than their clinicians. While clinicians are experts in knowing what types of PGD can be helpful for their patients' care, patients are experts in knowing what types of PGD they keep track of and why they do so. Without specific communications, clinicians would not get this patient information around the PGD. Thus, there is a need for mediation to bridge these information gaps between patients who are willing to share their PGD with clinicians, but wait for their clinicians to ask, and clinicians who see a possible benefit from being able to leverage PGD, but wait for their patients to offer. Here, we see a great potential for a PGD-integrated health IT system, such as an EHR patient portal or a personal health record app to help facilitate the early engagement between patients and clinicians and address the information gaps between them. As design recommendations, we suggest that emerging health IT systems be designed to establish effective information flow between patients and clinicians regarding PGD at the early stage of care. Creating features that guide more focused patient-clinician collaboration around relevant PGD, minimizing unnecessary data sharing efforts. This focused PGD tracking and sharing will help reduce the time to review PGD for clinicians, as well as lowering the burden and uncertainty around the PGD tracking for patients. And the second theme, reliance on memory. Our findings underscore the importance of patients recording PGD in a concrete form rather than merely in their heads. Prior work suggested that patients are more likely to keep track of their PGD when clinicians get involved with their PGD tracking. It would be important for clinicians to engage with patients for tracking PGD in concrete forms early in the care process. As design recommendations, we suggest that emerging health IT systems be designed to effectively record which types of PGD are suggested by the clinician to help patients track PGD in concrete forms. PGD available for review in concrete forms would help address the issue of reliance on memory and help patients and clinicians use their meeting time efficiently. Conclusion and takeaways. Drawing on the findings, we argue that major challenges around the PGD sharing may come from information asymmetries between patients and clinicians, and patients' reliance on memory for their PGD tracking and sharing. These challenges that our young participants faced would likely be amplified among older, less tech-savvy populations or patients with more complicated health issues. As healthcare technologies promise patient-centered, data-driven care, more work is needed to better understand and address the information-associated challenges around PGD sharing between patients and clinicians. Thank you so much for watching. If you have any questions or comments, please feel free to let us know. Thanks.